it's time for us to discuss about health. And health segment is up. We're going to be talking this morning in the light of the conversations that we began yesterday regarding sexual abuse. We're going to be talking about the health effects of sexual abuse. I have been joined in studio by Dr. James Clayman, who is an obstetrics gynecologist, and he'll be helping us to understand the issues that related to sexual abuse and the medical side of sexual abuse. Good morning, Dr. Clayman.
Yeah, good morning.
How are you, sir?
Oh, by God's grace.
All right, it's good to have you here.
Yeah, thank God.
Yes. So, help us to understand. I mean, it's natural to imagine that, well, listen, we had sex. How is it that you are now hurt, injured, or whatever that happens after that? What's the range? First of all, talk about sexual abuse, the injuries that can come from that, and then how bad can it get?
All right. Thank you very much. Yeah, sexual abuse, as we know, it can happen to the adult, it can happen to the child.
Okay.
All right. When it comes to child sexual abuse, it's any form of sexual advances, be it the physical or be it on the distance, now we know, which benefits the adult at the expense of the child, who has not yet reached the age of consent.
Okay.
Who has not yet reached the age of consent. Then, when it comes to the adults, then it is sexual abuse is anything in relation to sex which that person does not agree.
Okay. Okay.
Which that person does not agree.
Makes sense. Yeah.
All right. And if you look in our system, at least from the research done, at least about 27% of women in one way or the other have gone through sexual abuse.
Wow.
In the course of their lives.
Okay.
And if you look, 2 in 10 women, the research done says that 2 in 10 women has forced sex in their lives. And if you look at this, about 57% of them is between the ages of 15 and 18, which made that group very vulnerable when it comes to sexual abuse.
Okay.
So it is something that is there. And just yesterday, I was just looking through the statistics, and I was just so surprised and sad that it popped out that in Ghana here, every day at least 3 children are defiled. Every day. Which means that it's really a public health issue. Yeah. It's a serious, I would say a silent epidemic that, because it's not like cholera that people will run but it's an epidemic that is really underground in this our country. This our country.
Now, so talk to us about some of the physical damage that can come, from sexual abuse.
Right. If you look at it, let's start from the children. The thing is that the extreme is that someone can die from sexual abuse, even from bleeding.
Okay.
From tears.
Wow.
From sexual abuse.
That bad?
Yes, that bad. That is the extreme. Then the act is, especially at times on children, tears, various tears. I've seen a case where it's, the tear, the vagina and the rectum virtually has become one. Serious damages. And that child had about 7 operations to put her in shape.
Okay.
All right. Such a child, in future, if she's having sex, it will be painful.
Okay.
Which is going to affect her marriage and her relationship. Such a child, at times, even when they marry, they wouldn't like to have sex with their.
Okay, let's break it down a little bit. If you're going to, so you're saying that when such damage has occurred, you can't reconstruct enough for the person to be normal again?
No. It is reconstructed.
Yeah.
But the thing is that the elasticity is no more there.
Okay.
When that person is giving birth,
yes,
it might not really expand
the way
for the baby to. And such people are prone to obstructed labor.
Okay.
And obstructed labor means that the head is stuck at one place for a long time. And we know that can also lead to fistula.
Yes.
As we know, I mean, that can later on get rotten and form a channel between the bladder and the vagina, and the person can be sitting there and leaking. And at times, even it will even end up with the feces also leaking. Then also, such people, when they grow out during sex, because there is no elasticity, sex is painful. Sex is really painful. So they don't really enjoy sex as they should. That is why some even don't want to go into relationship at all.
Yeah.
Then the other, they can get sexual infections.
Okay.
You know, various sexual infections, including HIV, AIDS. Then also when they get sexual infections, at times this infection can go into the womb and into their tubes, and you know they are young. So when the infection goes into their tube, it can lead to the blockage of their tubes, and that will affect them in future in their fertility issues. You know, Ghana here, when you're a woman and you don't give birth, God help you. You know, at times even they don't even let the husband test, and they draw conclusion that is a woman. Yeah. So this, and then we know also about female genital mutilation, which is part of sexual abuse. Because if you look at it, the female genital mutilation, the reason why it's being done is to lower the sensitivity of the female so that she doesn't feel for sex.
Okay.
You know, and female genital mutilation has various levels. There are some even they take virtually everything down there. And then it also affects elasticity, because the scar tissue. And that is what the men say they enjoy, they have it tight there. But the thing is that the woman is undergoing pain, because when you penetrate, there is no, expansion. The same way it can affect delivery, because there is no expansion. And at times, if they don't take care, they don't come to the clinic, because there is no elasticity, when the baby comes out, it causes serious tears. Which can also lead to fistula and other things. So the physical aspect is really, really serious. You know.
It sounds horrible. It sounds horrible.
Yeah.
Now you are also an activist and an advocate. How, looking at the space, the Ghana space where we find ourselves, how prevalent is it in different parts of the country when you look about sexual abuse?
You know, at times when you go into this thing, you know, Ghana here, at times when you say something, some drag it tribally, and, you know, they might start giving some qualms and about it. But if you look at it critically, there are some areas, I don't want to, because that issue is sensitive.
Okay.
Sensitive. I just remember that 2015, when I was working at Lekma Hospital, I had 51 defiled cases, you know, in the year with 4 boys. And unfortunately, when it came into the paper,
what do you mean with 4 boys? Explain.
What I mean is that it's 51 defiled cases, including 4 boys.
Oh,
4 boys also were defiled.
Okay.
You know, they were also defiled, sodomized, actually. You know, and what I'm saying is that the journalists made a statement that 51 defiled cases in Teshi area. And the chief didn't like it. It's like, but the truth was that they all didn't come from Teshi area. Because it's a hospital, some even come from other regions. So when that statement was made, they were really on us.
Oh, I can imagine.
They were really on us. So when it comes to classification, you know, over the regions, I don't really want to. We can steer away from that. But of course, I mean, there are health statistics from the Ghana Health Service, so the statistics don't lie. But let's look at the issue of helping people to restore. You know, once what are some of the things that you can do in terms of medical care, in terms of advocacy? But let's start with medical care. All right. Medical care, generally when it occurs, you know, what we know is that in all these things happening, it's only about 2% that report. It's only about 2% that report. So all the statistics you see, it's only about the reported.
Underreported?
Highly underreported.
Wow.
Highly underreported. But because they are underreported because of even how we also react to it.
The stigma that's attached and associated.
And then also even how we react. Because there are various instances. it is, a teenager was, defiled by a big man.
Yeah.
And the question is, why did you go there? What did you go there to do?
Yeah.
So it's a problem. All right. When it occurs, usually they report at the hospital. Okay. Or they might report at the police station. If they report at the police station, they are made to write their report and other things. Then the police people give them a medical form to be filled, and they come to the hospital. At the hospital, they are taken through. If it's an emergency, they are taken on the side and seen. And at times also, it might not be emergency, but if it's a child, you are allowing a child that is abused to go and sit in a line and wait, and people are bypassing. That also becomes something like an institutional abuse. Yeah. So in a correct setup, they are usually seen separately. Seen separately. So, they go to the doctor, he asks them questions, how things happen, he examines, the victim, and whatever trauma is there, whatever needs to be done, various investigations are taken because you need to take some swabs, you need to do some various tests. Part of treatment also for medical legal reasons. You take that, and then usually if they came before 72 hours, they are giving prophylaxis. We call it for HIV/AIDS. They are giving some course of medication to take to prevent it, and also hepatitis B. That also they are giving some prophylaxis. And at times there are some also infections. If they test, if it's not there, fair enough. But if it's there, then they are treated. Then they are counseled. They are usually sent to the clinical psychologist. To counsel them, either with the parents or either the person himself go or herself go to the clinical psychologist, because at times even when they come to meet the doctors, they might not give us the full story. The clinical psychologists, they are adept in extracting the full information, so that also helps with the doctors who are taking care of such a person. So after seeing them, depending upon the conditions, there are reviews. And generally, if they have reported at the police station, we write the medical form that goes to court for the case to go on. And usually the medical form, they are supposed to pay. They are supposed to pay.
Which shouldn't be the case.
If you look at the domestic violence law, there should have been a fund by which should pay for that. But they are supposed to pay, and that at times blocks people from pursuing these cases. In most circumstances, it blocks people from pursuing these cases. Unfortunately, but we are fighting that form should the freeness to the victim should be there. And then also the other side of the story, which at times don't let people report, is that even if the perpetrator is put in prison, what is done for the victim? Nothing is given to the victim, no compensation, nothing in particular. All the debt they accrue, they pay for it themselves. I remember there was one case, we went to court 31 times. Before.
Wow, one case?
One case, 31 times. Imagine transportation up and down. At the point in time, if you are not going to give me anything at the end of it, then there's no point in pursuing it. So,
you mentioned earlier that the most vulnerable age group seems to be between 15 and 18. Can you give us a bit more light as to why the numbers show that they are more vulnerable?
They are more vulnerable.
But what would be the cause?
What I think is that these are the mobile ones. You see, these are the ones at times looking for jobs. These are the ones at times taking care of children in the house, the households. These are the ones in the educational structure, they are moving. You get me? National service. You see, they are all over the place being seen, and these are the ones also who dress.
Well, I think that I can understand how this will come about, because, like you said, they are mobile, they are visible, and it's almost like they're also vulnerable in the sense that they are beholden to others for survival.
Yes.
So whether it's a job, whether it's some caretaking, So what can we do to help as advocates? What can we do to help this group of people? Is there anything that we can even do?
There are things we can do. Okay. I think before they get to that age, there should be an adolescent comprehensive reproductive health education.
Okay.
And I always say this. The Kenyans have a set which they call the Tuko Pamoja. It is marvelous. I have applied it. I've done it in school, Teshi cluster of schools. I took them through it for 3 years. I've adopted a school that I'm taking through. And at the end of it all, you see that the children are empowered.
Okay.
Whereby if something is happening, they know how to approach it. Because at times, there are cases where someone is defiled or raped.
Yeah.
And you examine the person and there is no struggle. There is nothing. And people draw conclusion that possibly, maybe it is consensus or whatever it is. But the thing is that if they are trained, if they get this education, they can then struggle with the person. But where they had no education and are ignorant, at times they freeze. So by the time they are aware, it has happened without any struggle. And you might start saying that, there was some agreement. So first, the education.
Okay.
Comprehensive education. Second, the education can also be in the churches and the mosque.
Okay.
It can be in the churches and the mosque.
Yeah.
Whereby they are trained what to do when they meet. When I went to Israel, from infancy, you are taught how to defend yourself in case you are meeting such a case. And if everything fails, then you need to scratch the person's face for evidence.
Okay.
It's not that you for evidence, put your hand in the eye or scratch the face. At least when you scratch the face, the skin of the person will be in the fingernails, where they can do DNA and find out that, so that the person can say that I didn't do anything. Then they are prepared. Then also if it goes through the church, things happen. The church, the mosque, adults there. So the children also become aware from that point, and the adults also become aware. Because, for example, at times, you have a daughter in the house. Some adult comes to visit you and say, "Meyere, my wife."
Yeah.
And he hit the buttocks and, touches the breast. My brother, that is rehearsals for what to come.
Yeah.
But most time by our culture, we don't say anything. We sit down and look.
Dr. Clayman, how do we deal? Because for me, this is very problematic. Okay. I've seen it done. I've been very offended and very incensed watching particularly parents just look at it almost like an innocent, something that is going on there. Says, I won't even countenance when an older man says to an 11-year-old, "My wife." How is she your wife? But I mean, in terms of our culture, we've allowed these things to go on for a long time, right? How do we deal with this? How do we reverse the trend? I mean, it will not be easy, but whatever strategy we use.
I think there's no qualms about it. Well, I think that if you're a parent, and whether the uncle or whoever comes into their house and say "Meyere" and tap the buttocks, you should tell in front of the uncle and the child that, Akosia can never be your wife.
Okay.
He is too young to be your wife.
Thank you.
And don't touch her like that again.
Yeah.
To the hearing of the child.
Okay.
Because the thing is that if you become silent, then the child psychologically think that
it's permissive.
They've agreed.
Yeah.
And by the time you are aware, things have happened. And, so the thing is high time we say, when it happens in front of us, we give that comment. It's not you are not insulting the person. If the person is sincerely genuine, he even will be happy that you said that.
Yeah.
But if he has ulterior motive,
he'll be offended.
Then he'll be offended. So that the children become aware that that action is wrong. The children become aware that that action is wrong. The other step also is to have, as we are doing now, in the TV stations and the radio stations, we talk about it. But you see, at times, the radio stations in Ghana here, when they are talking about defilement case, they make a whole joke out of
Yeah.
it. It loses its seriousness.
I've noticed that a lot.
No, it's at times you sit and you what is, I mean, if it were your daughter, will you give all those description and this funny thing like as if it's
they're making comedy.
We are making comedy.
Yeah.
No, they have to take it serious. When it happens, they have to give the information in a serious manner.
Yeah.
And that also will help us, not making fun of the whole thing. Then also, our domestic violence law should work.
Okay.
They should make it in such a way that when it happens, it can go to court and the judgment can be as fast as possible. And those who are the perpetrators, they get the sentence or whatever they need to get. And I was suggesting something. People said I was going extreme. I was suggesting something that if a man defiles a child in a community, and it goes to court and he's found guilty, they should paste his picture in the community.
I think so. I agree. There's nothing extreme about that.
Yeah, they should paste.
There's nothing extreme about that.
So that will be a lesson to some of them that
absolutely
mankind, if I do such a thing, my picture will circulate. And that is it. But you see, we are in a society where even people beg for the wrong thing. When you are taking it to court, Ebusuafo will come and say that, no, that shouldn't be, contained or entertained.
No, I've always maintained that we have a culture where begging or apologizing is seen as punishment enough. And that's what I think, for me, that's what perpetuates a lot of these things.
Yeah. I mean, I had a case where a very high guru, defiled a girl of 16-year-old girl when I was in Mamobi. Wow. And I was really going to take the case to the boys in the community surrounded my consulting room. That it is their big man, and if I take the case to court, it will disgrace the community and blah. Man, the mother came and knelt in front of me and begged me that, Dr. Clayman, I don't want you to be killed. I don't want you to be traumatized. Please, you just let the case go. Yes, to that extent.
Wow.
To that extent.
So we are enabling perpetrators within our communities.
Our communities. Our communities. And there have been cases whereby when it came on air, people were asking, and she went there, what did she go there to do? And people will go to the house of the people, the pastors in addition, malams in addition, all begging because it's a big man. And that should stop. Anyone who that, if he respects himself, he won't go to that extent. He won't go to that extent.
Well, I mean, I think it's rather sad that these things are happening to us. Let's go back and just talk about the medical side of things. What can we do by way of not even medical, maybe more psychological? What can we do by way of assisting people who are traumatized to live normal lives again?
Yeah. Thank you very much. The thing is, we have the clinical psychologist there. Ideally, such cases, if it comes to you, the doctor, you can manage it on your own. The clinical psychologist has to come in.
So it's a team effort.
Yeah, it's a team effort. The clinical psychologists may be few, but they are available. There are some who are also strong activists that you can contact them, and then they can see to it. And at times also, even as I said, if the education goes to our churches, the pastors will have the knowledge to deal with these things. Because if they don't have knowledge to deal with this thing, you go and they will start proclaiming some things. Which are, but if they have that knowledge, then that will help. That will help.
Thank you very much, Dr. Clayman. Well, we've been speaking to Dr. James Clayman, who is an obstetrician, gynecologist, and he's been helping. He's also an advocate, for these situations that people find themselves in. We want to further this conversation as the days go by, just to help people to appreciate and understand that, look, if it happens to you, report it. If it happens to you, seek medical help. You don't need to live in silence and in disgrace and feel hurt. And then it becomes a real medical problem if you don't treat it early enough.
Hi guys, I hope you enjoyed this video.
Subscribe to our YouTube channel, The Citi Tube,
For exclusive breakfast daily content and other Citi TV programs.
like, comment, and share with your friends.